Reassessment of your patient. Reassessment is continuing on the initial steps of the assessment. The goal of reassessing your patient is to identify changes and trends in your patient condition as well as any treatment that you've already provided. You have to make sure that you never skip except when you are working on a life-saving intervention that would of course prevent you from doing the reassessment. Your ABCs, of course, are a priority, but if you've got time and there's no critical issues with the ABCs, then make sure you're doing a reassessment to reevaluate your treatment plan and how your patient's progressing or digressing overall. So again, you're going to identify the changes. These could be very subtle changes, a few points difference in blood pressure, maybe their pulse ox, pain, or they could be profound changes. This could be reassessment and you notice that you've now got a problem with something in the ABCs. You're again identifying your trends, so you're going to take your complete and accurate set of vitals. Also, if it's chest pain or some sort of traumatic injury, you want to continue to assess their pain level to see if their pain is decreasing, increasing, or staying the same. Are they deteriorating or are they improving? Hopefully they're not deteriorating. Hopefully we continue to see an improvement as we treat them and transport them. Make sure that you're communicating with the patient, so you need to explain the process. Consider the patient's feeling. They may feel anxious, they may feel a little bit embarrassed. Remember that part of the reassessment includes repeating the following. Your primary assessment, you're going to repeat your vital signs, any pertinent parts of the patient's history, and any pertinent parts of the physical exam in which you noticed earlier in your primary assessment. So again, you're going to repeat your primary assessment. You want to recheck for life-threatening problems. So you're going to reassess their mental status, make sure that they have an open airway and that they're able to maintain that open airway on their own. If not, we need to correct that. Monitor their breathing for rate and quality. Reassess their pulse for the same thing, rate and quality. Monitor their skin color and temperature. And reestablish your patient priorities. In other words, your treatment plan. Has your treatment plan changed? Can we still continue on down the same treatment path, or do we need to reevaluate? On a pediatric note, remember that the mental status of an unresponsive child or infant can be checked by shouting to see if they have a verbal stimuli, or by flicking the feet to induce the painful stimuli. Crying is an expected response from a child with an adequate mental status. So you want to make sure that you're reassessing and recording your vital signs. Compare those results with your baseline measurements, or your first set of vital signs. Reevaluate your oxygen saturation levels. Document findings to record and identify any trends. So think of an example of a problem that might develop into a life threat to the patient while they're on the way to the hospital. Repeat your pertinent parts of the history and physical exam. The chief complaint may change, especially with regard to severity. I mentioned a few chapters ago that you may have somebody that's complaining of chest pain and they're also having difficulty breathing. This may be where the chief complaint could change. You kind of need to figure out which one came first. Are they having difficulty breathing and this is resulting in chest pain? Or are they actually having a heart attack and the signs and symptoms associated with that is actually causing trouble breathing? So have those things changed. If we have a problem that's complaining of trouble breathing and they complain of chest pain at all, but we're able to fix or help alleviate some of their difficulty breathing, they may no longer have chest pain and they may just have shortness of breath. Ask about any sort of changes in symptoms, especially ones that you would anticipate to see because of the treatments administered, such as nitro or anything like that. Typically they're going to get a headache when you give nitro, and so you may want to ask, hey, has your headache gone away? Do you still have the headache, or how are you feeling overall? Repeat the physical exam to identify any changes from your baseline, and check any interventions. What have we done to try to fix the problem? Are those interventions working, or are those interventions not working and we need to try to come up with another plan? Ensure the adequacy of oxygen delivery and artificial ventilation. You'll do that by your monitoring devices, but also your vital signs. Ensure the management of bleeding. Make sure that if they are or were actively bleeding that we've addressed this and we've done everything we can to stop the bleeding. And ensure the adequacy of any other interventions that you may have performed. Describe an example of an intervention that might need to be reevaluated and discuss your process for examining it. Observing trends. This is done by repeating and reassessing these steps frequently. So you need to establish the trends and document those accordingly. Trending is observing patterns that have emerged among vital signs. So trends may indicate new treatments or adjustments to ongoing treatments that need to be made throughout the course of your transport. Make sure you're reassessing the patient's condition as well as the length of time that you have with the patient. This is going to help determine how often you're going to reassess. The more serious your patient's condition, the more often you should be reassessing. You should assess your stable patient every 15 minutes, and you should reassess your potentially unstable or unstable patient every 5 minutes. If you think that there may have been a change in the patient's condition, at least repeat your primary assessment. So let's review real quick. Reassessment is the last step in your patient assessment. Make sure that you're reassessing your stable patient at least every 15 minutes and your unstable patient or your potentially unstable patients every 5 minutes. Your elements of the reassessment are going to include repeating the primary assessment, repeating and recording vital signs, repeating pertinent parts of the history and the physical exam, and also checking the interventions you've performed for the patient. The interventions you need to check include their oxygen, any bleeding control, spinal immobilization, and splints.